It's no secret that diabetes is one of the most common chronic medical conditions on the planet. In America alone, about 11%, or about 35 million people or so in this country, have diabetes. And about 38%, which is almost about 95 million people, have prediabetes. Now, if we look at this segment of people who are older, 65 and above, about 50% of those people have diabetes. So this is a major problem in this country and around the world. In this video, I'm going to review 3 important associations between strength, muscle strength, and diabetes. So, number 1 we're going to talk about is the risk of having weak muscles and the development of diabetes. Number 2, we're going to talk about the risk of having weak muscles and the risk of having bad consequences from having diabetes. And number 3, we're going to talk about how exercise actually can help reduce the risk of developing diabetes. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in arthroscopic surgery and sports medicine. Studies have shown that muscle weakness is associated with a greater risk for those people to develop diabetes. For example, there was a study of about 1,900 Americans, age about 65 and older, with no diabetes at the beginning. And then they followed these people for 19 years. And what they found was that in women, those who had muscle weakness had almost a 40% higher risk of developing diabetes during that 19-year follow-up period. Interestingly, in men, it was only about a 5% higher risk. There was a meta-analysis of about 175,000 people that corroborated these findings, and they found that the people in the study, the third of people who had the greatest muscle strength, had about 27% lower risk of developing diabetes compared to the weakest group. And these benefits are incremental, meaning that as people increase their muscle strength, there is a reduced risk of developing diabetes. For example, there was one study that looked at 1.7 million people, and they found that for each standard deviation higher muscle strength was associated with a 30% lower risk of type 2 diabetes. So this is showing us that it's really important that you can keep increasing your strength while have continued benefits. On the way to developing diabetes, people will start with prediabetes, where their laboratories are not as bad as full-blown diabetes. And it's important to try to identify people in this stage to implement changes to prevent them from going on to getting diabetes. And identifying people who have weak muscles, especially as they're getting older, can help us identify people who are at risk of getting prediabetes. For example, there was a study that was done in Japan, and in this study they looked at about 1,000 older people who did not have diabetes and then followed them for 2 years. And what they found was that people who had greater muscle strength at the beginning of the study predicted a 40 to 60% lower risk for them to develop prediabetes within those 2 years. People with diabetes unfortunately suffer from many other adverse health events because of the diabetes. And here again, people who maintain better muscle strength, even in the face of having diabetes, strong muscles and strong strength can help reduce their risk of developing some of these adverse events. For example, there was a study that looked at 347,000 people from the UK Biobank study. And what they did is they compared people with diabetes either with muscle weakness or good strength versus those people who were not diabetic. And here's what they found, that a diabetic patient with muscle weakness had like a 200% increased risk of having some sort of cardiovascular event. But in diabetic patients who had good muscle strength, they only had an 11% higher risk of a cardiovascular disease event. So by maintaining good strength, they could reduce that risk from 200% to just about 10%. Incredible. And then they also looked at what about the risk for dying from cardiovascular disease. So again, a diabetic with weakness in their muscles had like over a 400% increased risk of death. And that reduced all the way down to just 46% reduced to a higher risk of death compared to those people who are not diabetic. So incredible what can be achieved in diabetic patients who maintain their strength to limit their risk of an adverse health event. And there were several other studies that also looked at diabetic patients with muscle weakness to see what other adverse events can occur. And so here are some of them. So one study found a 2-fold greater increase of ischemic stroke, Another study also found a 6-fold greater odds of peripheral arterial disease. Another study found about a 4 to 5% reduced risk of hospitalization if you are stronger. Okay, so for diabetic patients, trying to stay out of the hospital is important. And unfortunately, for those diabetic patients who are hospitalized, if they are weak and have weak muscles, they have about an 80% greater risk of dying in the hospital compared to diabetic patients who maintain strong muscles. So all of this is showing us how critical it is for diabetic patients to maintain strong muscle strength. Can exercise help us here? Can exercise help prevent or reduce the risk of diabetes? And you bet it can, and there are multiple studies that have looked at this. In one example of a study that looked at 35,000 healthy women, average age 62, and they looked at different types of exercise, strength exercise, aerobic exercise, or combining both exercises. They found that those women doing strength exercise could reduce their risk of diabetes by 30% compared to those women who were not doing strength exercise. Now moving on to aerobic exercise. They found that for those women who were doing, let's say, less than 20 minutes per week, they could reduce their risk of diabetes by 14%. Between 20 and 60 minutes per week can reduce their risk of diabetes by 25%. Between 60 minutes and 120 minutes per week, they can reduce their risk of diabetes by 34%. And then for those above 120 minutes per week, they can reduce their risk of developing diabetes by 50%. Huge benefits here. Now, what about doing a combination of the two, both aerobic and strength exercise? And so in the same study, they found that for those women who were doing more than 120 minutes per week of aerobic exercise and included strength exercise, that they could reduce their risk of developing diabetes by 66%. So again, a more added benefit here by combining the two. How does doing exercise rack up against medication to help prevent developing diabetes? And so there was a very interesting study that looked at this. They took groups of patients and they said, okay, what if we have them do lifestyle changes, which included exercise and better diet? They took patients that were given a medication called metformin and they had a control group. And then they looked at the three to see what would happen. So this study of 2,700 people followed the different groups. And for the group that was doing exercise, 150 minutes per week of moderate intensity exercise, they found that over the course of 15 years, they could reduce their risk of developing diabetes by 27%. And for the group that was taking medication, could reduce their risk by 18%. So we see that lifestyle changes such as exercise can be very powerful and in some cases may potentially be as powerful as medication. Let's wrap up this video and go over a few key points. Number one, maintaining good muscle strength can help reduce the risk of developing prediabetes and diabetes. Number two, maintaining strong muscles for those people who are diabetics can help reduce their risk of having adverse health events. And number three, implementing exercise in one's routine, both strength, aerobic, and especially a combination of the two, can help reduce the risk of developing diabetes. I hope you found this video helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.